Okay, there we go. Alrighty. Okay, so we've started now. Okay, so this evening we are speaking about people-driven smart policy. So with the tremendous push to become data and technology driven in government policy making and service delivery, have have we become too dependent on these tools to the detriment of society? Researchers from Harvard Kennedy School and IBM explore this question in the context of the pandemic. They laid the foundations for people-driven smart policy, a new framework to help put public sector leaders back in the driver's seat by maximizing the utility of data, technology, and critical thinking. For more information on people-driven smart policy can be found in there's a link in the description of our meetup page. I think one of the moderators can also probably drop that link in chat for your convenience. Our two speakers tonight are Rashi, and forgive me if I say this incorrectly, Khilnani.
You did it perfectly.
Did I?
Yeah, it's amazing.
High five myself.
Perfectly.
Really? Oh. Okay, so I'm like 1 for 2 names tonight. I'm proud of myself. All right, she is a public policy strategy and communications consultant with a passion for adding public value through ethical use of technological innovations and public-private partnerships. Rashi is a techno-optimist and has experience as an advisor to several startups in Canada and overseas. Rashi has an MPA from the Harvard Kennedy School. Her partner in crime this evening is Matthew Ledger, like Heath Ledger, is a policy analyst and researcher with experience in the field of local government innovation, emerging technologies, and homeland security. He currently serves as a policy research analyst at the Ash Center for Democratic Governance and the Innovation at Harvard Kennedy School, and as the director of strategy at Contrace Public Health Corp in Washington, D.C. Without further ado, I'll leave it to you guys.
So I think we have a little bit of a PowerPoint and I think Matt will be sharing his screen. Is that possible?
Yes.
Yeah, I should be able to just hit share. So give me just 2 seconds.
Sure.
No worries. This community is very patient with me. Show their patience with you.
Can everybody see this?
Looks great.
Cool. All right. We're good, Rashi, if you want to take it ahead.
Sure. But now my computer is being a little bit moody, so give me a second. Okay, so we're going to be able to go ahead. So thanks, guys, for coming out tonight or staying in tonight, as it may be. And welcome to our presentation on people-driven smart policy, or PDSP. Matt and I really happy to be able to present to you today. And during the pandemic, Matt, our co-writer Jean-François Barsoum, who works at IBM, and I spent a lot of time thinking about data and technology. And as was said in the intro, I'm a techno-optimist, but actually all of us are, and we believe in data optimization. And we were really happy to see a large-scale adoption of technology during this time. Now, and this included everything from, us buying our groceries online to seeing doctors online. And I think we can all agree that technological advancements has made a significant dent in helping the world manage the COVID-19 outbreak. So scientists were able to track and identify the disease faster than ever, to share information and collaborate on necessary research from all corners of the globe. However, we also found that access to data doesn't necessarily mean that it will be taken into consideration or that decision makers will know how to best analyze or use it for their purposes. And this is where we came up with people-driven smart policy, or PDSP. So what is PDSP? PDSP is a public policy approach that maximizes the utility of human social, cultural, emotional, and intellectual capacity, and couples this with technological advances to fill in critical data gaps and drive inclusive, evidence-informed interventions. So in other words, PDSP prevents an over-reliance on technology and data when making critical policy decisions, and it puts people back into the proverbial driver's seat.
So as we all know in this group, technology has tremendous potential to do amazing things for society. In the last several decades, we've seen the emergence of incredible tools that have proven to be very helpful during the pandemic, whether we realized it would be or not. In our research, we came across a wide range of technological solutions used by governments to help respond to the outbreak. And this includes artificial intelligence that was used to try and predict patient outcomes and to anticipate the emergence of new hotspots. Some governments use drones and autonomous vehicles to deliver critical supplies to hospitals and quarantine patients. Some countries are even using contact tracing applications, as Canada is very well aware, to varying degrees of success. And governments have also leveraged social media activity to monitor for potential outbreaks and target public health messaging. But despite the availability of these tools, to put things a little bit diplomatically, the responses we've seen to COVID so far have not been ideal. But stop for a moment and think about how bad things would have been without the ability to rapidly shift to remote work for those who are fortunate enough to be able to do so. Think about how much time it would have taken for public health professionals to actually be able to accurately diagnose and treat COVID if they weren't able to collaborate and share data and research using online collaboration tools. If you really think about it, the technology right next to you or in your house somewhere, your Wi-Fi router may have saved millions of lives without realizing it. So equally important to technology is the data that these tools allow us to collect and analyze. Data has played a critical role in response to disease outbreaks for centuries. For all you Game of Thrones fans in the crowd, the original Jon Snow actually looked nothing like the one you're familiar with on the left. The Jon Snow that's the hero of our story was a doctor from the 1800s, and his enemy was not the Night King, it was cholera, which is a waterborne illness. Back in the 1850s, a cholera outbreak swept through the Soho neighborhood of London, killing nearly 130 people in 3 days. The OG Jon Snow on the right came through knocking door to door in the neighborhood, talking to local residents about their symptoms. Using pen and paper, he plotted his results on a map of the neighborhood, highlighting which houses had residents who had presented symptoms. And with this information, he was able to narrow down to the source of a specific water pump on Broad Street. And when he convinced the local government to go in and shut it down, he cleaned it out and was then credited with ending the outbreak. And he's since been deemed the father of epidemiology. Today, epidemiologists still employ much of the same grassroots tactics and analytics techniques that Snow used, but more sophisticated. But the principle is the same. Epidemiologic data collection is a bottom-up approach that starts in local labs and moves up through the higher rungs of government. And modern technologies have sped up the process of early stage data collection so that scientists and epidemiologists can identify threats faster and intervene. This in essence is the idea behind the very famous Johns Hopkins dashboard that's been used by millions since the start of the outbreak. Many of you have likely seen at least a screenshot at some point in the last few months. If not, here's your screenshot. The dream capability for epidemiologists is to be able to collect data in near real time to intervene before the public even hears that an outbreak is on the horizon. However, these near real-time capabilities are not widespread. In fact, only 1 in 5 countries globally have advanced early detection and reporting capabilities. During the course of our research, we spoke with several epidemiologists who shared the challenges in using testing data to track the spread of COVID. And as I'm sure we're all familiar, in the early days, testing was not widely available, and it could take up to 3 weeks to get test results back. And this meant that the data showing where cases were ballooning early on was always nearly a month behind. And this is effectively an eternity in the world of infectious disease outbreaks, but it's the data that we had to work with early on. In some places in the US, it still takes up to 2 weeks or more to get your test results back. And this shows how critical it is to be aware of the limitations of the data that you're using during times of extreme uncertainty. The bottom line is that the faster data can be collected and analyzed at the outset of a potential outbreak, the better public health professionals are able to respond. And even before COVID, there was a great push to enable more proactive rather than reactive capabilities. And there will likely even be a greater push for this moving forward.
So as Matt showed, data and technology can have a significant positive impact. So it's no wonder that there's been a push over the last decade to become more technology and data driven in public policy or in any field for that matter. But what happens if we take this push too far? do we rely on these tools too heavily? So I'm going to give you the example of Singapore. So Singapore is famous for its technological capacities, and its government is considered to be one of, if not the most technologically advanced in the world. In the early days of COVID, Singapore was lauded as a champion of the pandemic. And this is because it used contact tracing and technology to quickly identify and quarantine sick people and prevent a national crisis. But then something happened in April. The migrant community clustered in the ports there experienced an outbreak. And many of them lived in cramped dormitories, which allowed for the virus to spread very quickly. And this led to a huge national outbreak by Singapore standards. And given the lack of citizenship amongst the migrants, there was a gap in the data being used to monitor the disease in their communities. And this is what we refer to as a data blind spot. So Singapore today has over 57,000 cases, and 95% of those cases are migrant workers. And it had managed to put things pretty much well under control come June, July, once it recognized the data blind spot. But as of 2 days ago, they've noticed that there's a rise in numbers once again, perhaps a second wave in the migrant community. But at least they're monitoring this community right now. And can you imagine just how much more the disease would have been spread if they hadn't had that? So in the US, there's a new study that recently revealed major gaps in biosurveillance data in low-income postal codes. And these also happen to be where viral outbreaks often take the greatest toll, and as has been the case with the coronavirus. Now, politics aside, even if the data and the red flags raised by public health leaders in the US had been taken seriously from day one, these major blind spots may very well have led to a loss of control of the virus in poor communities and henceforth the nation. And that sounds a lot like what happened in Singapore. So pandemics aside, there are plenty of examples of where an over-reliance on data and technology has led to poor outcomes. In Arizona, a safety backup driver behind the wheel of an autonomous Uber took their eyes off the road to watch a YouTube video on their phone. And meanwhile, the vehicle hit and killed a cyclist because the sensors were unable to properly react. Black Lives Matter has been in the news a lot recently, and so has policing techniques. And in policing, it's widely known that facial recognition technology is largely inaccurate at identifying people of color. And yet it's been used to identify criminals, leading to the wrongful arrests of innocent people. Let's not forget that AI and algorithms are built by humans, and they're not immune to the biases of the humans that create them.
To really summarize our overarching goal with this piece, it's our hope that we can get people thinking more critically about our over-reliance on data technology in our increasingly complex world. In times of extreme uncertainty, such as the COVID-19 pandemic, it may feel natural to turn to these tools and data in hopes of finding the answers that you need. But data and technology can only go so far in understanding the intricacies of the real world that we live in. And so it's imperative that we begin to re-emphasize the role that human input must play in these moments.
So what's next for PDSP? Matt, Jean-Francois, and I will be going back to the drawing board, and we're conducting further research to help public sector leaders govern with data more effectively. We're also building a decision-making framework that helps policymakers through crises or moments of uncertainty. And this will be guided by a series of questions that can help public sector leaders ensure that they're not skipping critical steps or missing important data that can influence outcomes. So the questions will also encourage public leaders to think critically about how to fill in these data gaps. So for example, for what populations do we lack information? What other agencies or entities might have the data we need? what are the limits of the data we have at our disposal, and is our technology or data inclusive of all communities? So basically, the idea is to ensure that the modern day Jon Snows of the world are able to bring their critical thinking skills to the forefront. Thanks very much. And now questions.
Yes, if you have questions for our fantastic presenters, feel free to drop a Q in the chat and we can read out your question, or we can just call on you, whichever you are more comfortable with. All right, I'm starting to see some cues coming in. Okay, let's start with, forgive me if I'm mispronouncing this, Oshnish?
Yeah, so I missed part of the presentation, so pardon me if you already covered this. But I'm just seeing in terms of data availability for either citizens or even researchers, there's a regression going on to some extent. You know, just because something gets